Hello again, this is Dr. Deuk with Spine Scams Exposed, and we're going to be talking yet again about a issue in spine surgery that keeps rearing its ugly head, and it has to do with what's called total disc replacement or artificial spinal discs. Now, I've been on Facebook moving around between different groups, and I keep seeing a recurrent theme coming up, and that's people who have had artificial disc surgery done either in their neck or their lower back, and that's for neck pain, pinched nerves, or back pain and pinched nerves. And this is a thread that I wanted to bring to your attention and talk about. This is in the cervical disc replacement surgery and a few other threads, but we'll start with this one. This person says, how long did you experience tightness and soreness in your shoulders and upper back after a C6-7 disc replacement? I'm 3 weeks out, and it's not unbearable by any means, but super annoying, especially since my doctor doesn't want me taking ibuprofen until the 6-week point. So here we have a patient who obviously had artificial disc replacement done for one disc in their neck, and 3 weeks after surgery they're still in horrible pain. And they're just saying, what's going on, right? So then we get an outpouring from the community. I mean, we got comments from like literally 20 people, and they all have the same problem. Artificial disc, they're still in pain at different time points after their surgery. Again, this is a common theme. So why are there so many surgeons putting artificial discs in if there's so many problems with them? Number two, why are patients getting artificial discs put in when there are so many problems with them? And it's a pretty complicated answer, but I'm going to lay it out for you. The reason why surgeons are putting artificial discs in is because patients want them. So the companies that basically manufacture these artificial discs, they've paid hundreds of millions of dollars for the technology, basically for the IP, intellectual property. So now they got to take that IP and they got to convert it into a profit, because these are for-profit companies. We're talking about companies like Medtronic, Sofamorganic, Deuk, Johnson & Johnson, Nuvasive, Alphatec, you name it. There's a company out there selling artificial discs, right? And so these companies are really, unfortunately, in bed with the surgeons. And the surgeons are wanting to put artificial discs in to make the companies happy. Sometimes there's a financial arrangement we don't know about, and that's motivating the surgeons to put in these artificial discs. These artificial discs for the spine, they came to the market late in the United States, and they were FDA approved back in around 2000. Okay, and so we started putting artificial discs in. The first thing I noticed was that the surgeries involved a lot more damage to the soft tissues to get the artificial discs in, especially in the lower back, because you got to go through the belly. So there are more dangerous surgeries right off the bat. And on top of that, it turns out artificial discs, they pop out. They fail. If you put them a little to the left or to the right, they cause all kinds of problems for the patients, like a lot of pain and nerve damage. So what we were seeing was complications from the artificial disc, and the results of the surgeries just weren't that good. Yet, the data that was coming out from the companies that were manufacturing and selling the artificial discs, and the party line, so to speak, was that they're great and let's keep putting them in. So I don't really put artificial discs in people because we have a much better natural way to treat herniated discs that involves a laser and repairing the herniated disc rather than taking the whole disc out and replacing it with a cage or an artificial disc. Check out this video. We're going to show you how the Deuk laser disc repair works. This is state-of-the-art technology. It comes out of Korea and Germany. I brought it here years ago and I modified it, and we basically created a surgery that's so gentle that uses a laser just to clean out the tear in the back of the disc, removing the herniation, debriding the annular tear, which allows patients to restore normal, painless movement and get back to a normal life without any implants at all. All right, let's get back to our Facebook post here in the cervical disc replacement surgery chat room. And this person said, I'm 3 weeks out from a C6-7 disc replacement. I'm in horrible pain. The next person says, well, I'm 2 weeks out, and I definitely feel the pain myself. I've been taking ibuprofen around the clock since I was discharged. So you're supposed to get the artificial disc to get out of pain, but these people are in more pain after their artificial disc. Here's another customer of artificial disc. I'm a year out from my C5, C6 disc, and my muscle tension in my neck and shoulders is worse than ever, particularly in my neck. I have tension headaches. I've got tightness in my neck and shoulders almost daily, pretty much all day. That's what they're saying. Let's go to the next comment. This patient saying, I'm sorry that you're having ongoing problems. I had my Moby surgery on January of 2020. I had to have the disc removed in October of 2020. So literally 9 months later, I just gave up. It was hurting me so bad, I took the disc out. It seems that these artificial discs really work for certain people, but not others. I happen to be somebody it didn't work for. His pain was horrible. And basically they instead had to have a 4-level fusion. So basically they got their 1-level artificial disc taken out, and it done so much damage to their spine that they needed 4 levels fused when they took the disc out. So look, from a surgeon standpoint, that case, they made money putting the artificial disc in, they made money taking the artificial disc out, they made even more money doing a 4-level fusion. This is a 2-level fusion. Check this plate out. That thing's huge. That's just 2 levels. This person had a 4-level fusion. Imagine the plate going down to here. Your swallowing tube sits right in front of that. That swallowing tube is going to be scarred forever. Your voice is going to change. You're going to have hoarseness. Why would you ever want to put yourself through such a catastrophe of a treatment for a herniated disc when you could have laser surgery to repair it with no metal, no fusion, no artificial disc, and no problems? The pain is gone literally the same day. All right, here's another person that says, check into thoracic outlet syndrome. I had 2 discs replaced in my neck with 0 relief. And then I was told I had thoracic outlet syndrome. Folks, this is craziness. Here's a human being saying, my surgeon took out 2 of my discs and put in 2 metal discs in my neck, and it didn't work. I still had neck pain and arm pain. The surgeon goes, well, maybe you have thoracic outlet syndrome. Well, shouldn't you figure that out before you did the surgery? I mean, why would you put these artificial discs in people that aren't going to work? This seems to be the norm. Let's go on to the next one. This person saying, I got 0 relief from my Mobic C5-6 in July 2020. Now I have the same horrible pain in my right arm and new pains in my left arm and my neck. Oh, and the migraines I'm getting. You can see these posts. Okay, we're going to put them up here for you to check them out. This guy says, this is all BS. I thought surgery would help. Yeah, BS indeed. They just keep taking tests like MRIs and X-rays and nerve tests. They're wasting my time. I'm exhausted from the pain. Blah, blah, blah. All right. Here's another one at the bottom that says horrible pain, 18 months. So we're seeing a common theme. People are having lots of problems after they get an artificial disc put in their neck or their back. And they're not happy, folks. And they're having to have 2 and 3 more other surgeries. This shouldn't be happening. Here's another one that says, I just had my Mobic C removed and fused. Best decision I ever made. That thing was the devil. Here's a patient calling the artificial disc a devil. You imagine the pain and suffering that they went through? Well, that's what the devil does, isn't it? The devil specializes in torturing people. So this person's basically calling their disc the devil because they were tortured when they had it in. Their pain is now gone because they had the disc taken out, they're fused. Finally, here's someone down here who says, it took me over a year to find a surgeon who recommend removal. So here's another problem. Surgeons put these artificial discs in and then they don't want to take them out. Why do you think they don't want to take them out? Number one, they don't want to get in trouble for putting it in the first place when they shouldn't have. Number two, taking the artificial disc out is dangerous because you've got all that scar tissue from the first surgery that's developed over that time. And that's scarred to everything, the esophagus, the trachea, the carotid artery. In other words, the risk of taking these things out after you put them in is so high, the surgeon wouldn't even take it out. So this patient searched for a whole year to find someone who'd be willing to take it out. One more person here says, mine initially felt better, and then some of the numbness went away immediately, but as the months went by, it started hurting again. Tests showed the disc right below had collapsed. Okay, so here's somebody who had an artificial disc put in, and then months later, the disc below the artificial disc went bad. We call that adjacent segment disease. Well, remember, the whole point of putting an artificial disc in is to prevent adjacent segment disease, so it doesn't happen like it happens with fusion. Well, here's somebody that got adjacent segment disease from an artificial disc. So the whole selling point of artificial discs instead of fusion is you don't get adjacent segment disease. Well, obviously that's not true. So basically, you've got story after story. This is literally just one post on Facebook. But I see these all the time. I want to make you all aware. I believe artificial discs are a scam. I don't put them in. I think they're dangerous. The surgery is dangerous. The revision surgery is dangerous. They don't work for the most part. Yeah, once in a while somebody gets a benefit from it. But for the most part, there's a lot safer and better surgeries like the Deuk laser disc repair, endoscopic laser spine surgery. No metal, no open surgery, no hospital, no bleeding, no scar tissue, and no complications. Nice talking to you. I'm Dr. Deuk. Enjoy Spine Scams Exposed. We'll be back for the next edition later on.